This is an updated fibroids video. The last time I created a video, I still got so many questions, even to this date, and I'm like, how can I refer you to the first videos? And I decided to do an update. So we're going to talk about fibroids. These are 8 main points where I got from the most common concerns that people had. One, we're going to discuss what are they, who gets them, what causes fibroids, what are the signs and symptoms, how are they diagnosed, effects on fertility, effects on pregnancy, and treatment options. Are there treatment options? So this is how the video is going to go. Now, beginning from what fibroids are non-cancerous tumors, or they're non-cancerous masses that occur in women, in the women's uterus, in women of reproductive age. Now, because of this reproductive period, I hope you have remembered that for every stage of woman campaign that Maristops is running that is focusing on that period between menarche straight into up to menopause. The For Every Stage of Woman campaign is basically made to be able to address such issues that women be having, and to be able to guide and progress these types of movements, empower the girl child, educate you on your body, understand it, teach people as well, so that you're all able to understand what is it that happened. If you're a teenager, what issues do you have? If you are began your periods become so heavy. Is it normal? Is it not normal? Because things like PCOS can be diagnosed in girls even before their period has come, or even after the period has come, that early. So you need to be able to be around people who can guide you properly on knowing what it is that is going on. Who gets them? Anyone who is in the reproductive age group. So girls from menarche up to menopause. Menarche is the time where a girl sees the period for the first time. So that's about 12 years, 13, 14, 15. Why? Because fibroids tend to be hormone dependent. They love those hormones. Estrogen is something that they tend to thrive on, hormones like progesterone, and that is why they are common in that age group. So what causes fibroids? This particular part is not very clear, because fibroids have had a lot of theories that have gone around them. But one thing that we know is that it's a genetic mutation, and this causes overgrowth of cells, causes masses, things like this to be able to grow in women. However, it has a lot of genetic predisposition. So if your mother had them, your sister had them, your aunt had them, direct contact, you will tend to have a predisposition to these as well. Not to forget that also us as Black women, we tend to be predisposed with this because of our descent and our race. It is not clear as to why, but just that we tend to fall into this category. What are the signs and symptoms? The signs and symptoms of fibroids range right from no symptoms at all to severe symptoms that can cause heavy bleeding and anemia. So for example, one thing that tends to give us the first indicators is irregular bleeding. Very painful menses. The menses can be painful, and so that's why I always say, if you feel like your periods are too painful, it's always better that you first go to the hospital, let them rule out other possible causes of these, and then you can be able to say, okay, I just have painful cramps. It's not every time that cramps are just painful, it is just that. So it is important that you get these things assessed. So you can have very painful cramps, you can have irregular bleeding, you can have really heavy bleeding. Fibroids, as they grow, they expand, and so when they expand, they can cause enlargement of the abdomen. So you may think you're just gaining weight. Some people even look pregnant when they are really big, but when it's not really the case and they are actually growing. So because of this expansion, they can cause pressure symptoms, and the bladder is in front of the uterus, and then the rectum is behind the uterus. So if this is your uterus and the fibroid is growing towards the front, it will cause pressure onto the bladder, causing you to pee a bit more often and feel irritation a bit more often, like that. If it's going towards the back, towards the rectum, you will tend to have pressure symptoms. You feel like you want to go to the toilet for a long call, or you begin having also things like constipation. This entirely depends on the location and on the sizes of the fibroids. How are they diagnosed? So fibroids, what you need to do is, first of all, you go to your hospital. Please, by all means, make sure you reach out to the Maristops pages. They are doing a lot more of this answering. When I am here, I am your teacher. I am your health educator who is a doctor. But then when you are in touch with a physician, that now becomes your doctor. If you have an issue that is personalized, reach out. The Maristops pages are running to be able to answer these questions. The campaign is going to last for a period of 3 months. So when you discuss with them on such issues, they can help answer and guide you with a plan that is customized for you, because they also have a team that is made for such things, to see women from the beginning to the end all types of women, all types of things like this. So this is one thing that they do. So when you get this type of issue and you're concerned, go to the hospital. Let yourself be assessed. Your history is going to be taken and is going to listen to you. They do an examination on you. We do an exam on you. And then after that, we investigate. One method of investigation that tends to be the most helpful is the ultrasound scan, because it helps us to visualize and see what is going on, the location, where are they, how many are they, and what effects are they doing. Sometimes you may need to be able to do a bit more, for example, in cases whereby surgery is required, and things like more advanced technologies like MRI, magnetic resonance imaging can be involved to be able to have a clearer look on what is going on inside there exactly. So that's something that can help us a bit more with diagnosis. Effects on fertility. Now, when it comes to fertility, like I said, for some fibroids, they have no symptoms. They have no issues. You will not have difficulty with having a child. It is okay. You just have the fibroid. It's there. Many women, you find, by the time you go to deliver or during the C-section, you see she has a number of fibroids that are in there. Also, the baby's there, has been carried to term, and they are healthy. There is that category. Now, there are some, depending on the location of the fibroids, you're going to have different symptoms, which brings me to this particular illustration. When it comes to fibroids, the location is much more important in causing effect as compared to the sizes. So this is the uterus that we are having here. Now, these are the layers. So the uterus has layers. So this is the body of the uterus. This is the cervix. Down here is the vagina. So the layers of the uterus are three. This is called the endometrium. This is called the myometrium, or the muscle layer, and this is called the perimetrium, or the most outer layer, also called serosa, these particular ones. So the fibroids are also going to grow based on the location in which they are. If they are here, under this layer, for example, these are called submucosal fibroids, okay? Now, there's also the ones which are also here, in the muscle layer or the myometrium. These are called intramural fibroids, or in the muscle fibroids. And then you also have some which can go under there, and they're called like subserosal fibroids. You can also have others which are called pedunculated, so it comes like that and then it pops out of here. Now, this is how they can affect. For example, when it comes to submucosal fibroids, these ones can cause difficulty in implantation of the baby. So the fetus will have, because this baby tends to come and want to implant around here, around there, because it is in this layer that it implants. This is the layer that sheds when you have your period. Every time, it's the layer that comes off. So when the baby comes, and now if the fibroid is here, unless the baby also comes, the egg comes and then finds its way to here and finds a fibroid, obviously it's going to have difficulty implanting and you may not be able to conceive. Also, the next one are these ones which are here, if the intramural, because the muscle layer is the one which contracts. So even when a lady is in labor, the muscle layer is the one which keeps contracting. So anytime you put anything there, that's why things like adenomyosis tend to be very painful, especially adenomyosis. Why? Because these particular ones are implanted into the muscle layer. So because of this, you find it contracts all the time. So when you attempt to get pregnant, as it's also trying to remove the fibroid, it's also going to keep trying to remove the baby. That's one unfortunate occurrence. Now, these ones, like these ones which are up the side, subserosal, these ones up here, they tend not to have a much effect on fertility. You can conceive your baby as well. You just have other symptoms. For example, if it is so big, goes into the intestines, causes things like constipation, difficulty in movement of stool and the bowel, okay? Now, if you have fibroids, for example, which are located around here, so obviously if it's located around here, when the sperm is coming, it's not going to be able to allow it to go through. So that is how you're going to have infertility. Or if it is located around here, and it begins to block the ways to the tubes and the ovaries. So when the sperm now comes, if it finds it comes here, it finds this side is blocked, there's going to be no way that it's going to move this side to meet with the egg and be able to get you to have a baby. So that is how they affect fertility. Take note, when it comes to fibroids, the location is much more important than the size of the fibroids in being able to affect fertility. By the time it affects fertility based on the size, they have to be very many, or it has to be really, really big. Next question is the effects on pregnancy. One, like I said, you can be able to get pregnant with ease. You can be able to conceive. You can be able to have a child. Some women will not be affected by these fibroids at all. They get pregnant, carry the baby to term, and it's all good. However, others may have recurrent miscarriages, and the baby keeps on terminating because, like I said, the problem of space and things like that. Others can have preterm deliveries, is, for example, when someone has a fibroid inside the uterus, imagine the baby is here. If the baby is growing, for example, in this space, and the fibroid is also there like this. So they're going to begin competing, not to forget that it's going to compete with the baby for nutrients, depending on how big, and also want the blood supply. Fibroids tend to be very highly vascularized, meaning they have a lot of blood supply. So they will compete with the baby for nutrients and blood supply as well, and also for space. So you're sharing the house and you can hardly grow. So you get something called intrauterine growth restriction, which is basically where the baby fails to grow, becomes undernourished, and also the weight is very small. So sometimes they'll have to deliver them preterm because the baby basically is being competed for. Space and nutrients are not really adequate. So that is how it is that they will affect pregnancy. But other people can be okay, like I said, and others can completely have difficulty with conception. That is one thing. So it ranges. You need to sit with your doctor and be able to have these questions answered. Sit with your gyne, let them be able to guide you and help you move forward. Because here, I am your teacher. I'll emphasize, I am not your doctor. Unless you find me in the consultation room, I cannot give you customized care that is meant for you. So finally, what are the treatment options? And are fibroids treatable? One, yes, they're very treatable. It just depends on what exactly it is that we are doing. Why? Now, let me begin by saying this. If the fibroids do not give you any symptoms, we do not bother them. We leave them in peace because they're not giving you any symptoms. So we just allow them to be. Now, the other option is the medical options like hormonal therapies, like combined oral contraceptives. These tend to help a bit with balancing with hormones. But again, I'm saying this is case by case basis and for particular people. There's options like surgical options. Surgical options also vary. You can have whereby some decide to do this, the common thing called myomectomy, where you just enter the uterus, cut out the fibroids, and then leave them to be, especially if a person is interested in fertility. Another option is, it's called uterine artery embolization, where a certain component is put inside the uterine arteries to be able to cut off blood supply of them to the fibroids. It sometimes can also have an effect on fertility, but this is also another option that is there. The third option is something called hysterectomy. This is basically removing the entire uterus. I'm going to attach images of some really, really very bad looking fibroids, and then you can see sometimes they cause the symptoms to be very horrible. You can find women, the quality of life is severely compromised. You're continually bleeding, you're in a lot of pain, you have a lot of pelvic pressure, back pains, things like this. You bleed all the time, you're severely anemic. So at this point, you have to be like, okay, are we going to save this uterus or are we going to save the woman? And as you as a patient, when you have such information, you're able to make better choices for yourself and for your loved ones. So that is it on fibroids. I hope I've exhausted everything. If I'm not able to respond to you in the comments, kindly reach out to the MariStops pages. They are running this campaign to be able to answer and guide on these things. Again, I'm saying it is running for 3 months. So within this period of time, they're able to tackle such concerns, guide you and help you throughout the process. That is it for today. Otherwise, class dismissed.